If you're struggling with sciatica and you're trying to find relief without going down the surgery route, in this video, I'm going to give you 3 releases to reduce your sciatica pain by 80% or more. And the best part is you can do them from home today. All right. So if you don't know me, my name is Jake. And about a year ago, I was like you. I had crippling sciatica pain and I had tried everything to fix that pain. So I had tried stretching. I had tried the chiropractor. I had tried physical therapy. I had tried pills. I had tried muscle relaxers, pain relief. All of these things did not do anything for me. And it wasn't until I stumbled upon these 3 movements that gave me the kind of instant relief to sort of get back to my life, to sort of start living a normal life again. So if this is you, if that sounds relatable, keep watching. You're going to get exactly what I talked about a second ago. If that's not you, you can close out the video. If you don't know what I'm talking about, this video is not for you. But if you're still here, let's go. So this was me before finding these movements. I was in about an 8 out of 10 pain. Now on the left over here, obviously you can't see my pain levels, but you can see this wonky shoulder here, and you can see my hips shifted over to the right. What you can't see is this excruciating pain in my glute and down the back and side of my leg, especially right in here. Oh, it was the worst pain ever. And maybe you can relate to that. And just 4 weeks after starting to implement some of these movements in my own life, not only did my posture greatly increase, I got a little taller, but the pain relief was immense. This quite literally changed my life and allowed me to start rehabbing my body so that I could get better for good. Completely naturally, without surgery, without chiropractor, needles, injections, pills, all of this stuff. And so I know your time's valuable, so let's go ahead and get right into it, shall we? The first movement or release that gave me immediate relief was the Right. Okay, so if you've never seen this little device, it's called a Right. Let's see if I can zoom in for you. It's that little blue thing right there. And the entire point of this Right is to myofascial release those inner psoas muscles. So when we sit down, like I'm sitting down right now, you're probably sitting down while you're watching this video, these muscles get super tight. And you can see where these psoas right here attaches down around the bottom of your spine. And if you're dealing with sciatica, odds are you have a herniated disc, which accounts for most cases of sciatica pain. So if you have a herniated disc, you have a disc that's either bulging or pressing against that sciatic nerve down here, probably around the L4, L5, S1 region, down towards the lower end of your spine. And if these muscles are shortened, these muscles will quite literally pull on the spine right here, pull on the spine and cause that herniation to progressively get worse, which means you're going to be in worse pain because that disc is pressing stronger and stronger against that nerve. Okay, so it only makes sense if you can loosen this muscle, if you can loosen this fascia around this region, you're going to experience immense relief around that area because that disc is going to recede or retract off of that nerve. Okay, and so it's called a Right device. And what I want you to do is go ahead and get one of these. They're not too expensive, maybe like 20 bucks tops. You can get them on Amazon, you can get them anywhere, or you can even kind of DIY your own. But once you lay down on this for about 10 minutes, down around that iliacus or down around that psoas region. So you can see where it is on the body. Go down there, lay on it for about 10 minutes, melt into it, fully breathe into it, and just relax. Let it loosen up those muscles. And when you stand up from it, you should experience some immediate relief. It did for me personally, and I have a feeling it will for you too. So let's keep going though. So this is everything I just talked about. What this will do for you is give you relief off those compressed discs. And once that fascia is released, it'll help you to engage those glutes, to actually use your posterior chain, to use those hip extensor muscles again, which is going to stabilize your core, which is going to lead to all kind of great long-term effects. But for today, this should give you amazing relief. Okay, so let's keep going. The second thing I want you to try is the overcame up around your upper abs. So these pictures are courtesy of Naudi Aguilar and Functional Patterns. And this is myofascial release up around the upper abs. And what this is going to do for you is actually release that fascia, release those muscles that become awfully dormant when we sit too much. Okay, so if you're like me and you maybe work from a desk, maybe you sit down, you watch TV a lot, what have you, these muscles, this fascia in this upper region become very tightened and they become kind of stuck and dehydrated. And so the point of this, if you can release say, this muscle, this fascia right up under your rib cage, is going to do a couple things for you. You're going to be able to stand taller. This transverse abdominis, which has probably gone dormant for you, is going to become active again. And when that becomes active, it's going to stabilize your core and help those discs in your spine not to constantly be compressed. When you walk around, when you move around, it's just going to stabilize everything, keep it tight, so that you can get back to using your body. And the second thing it's going to do for you is allow more thoracic extension through your spine. So it's going to allow you to stand taller. It's going to allow those discs to grow, like find space in between them so that you can get some relief. Okay, so again, this is the Theracane. Again, not more than like 10, 20 bucks, but you could also do this with something like a broomstick. So you could do this today from home right now. Give this a shot. So press this into that region right up under your rib cage. Hold it for about 5 minutes. So we're not going for painful. We're going for kind of like a discomfort feeling, and just hold that there, let it release. And then when that side is done, go ahead and switch over to the other side. And when you stand up, you should feel how your body is much, much, much more fluid, and you're moving better, you're feeling better, and you should experience some immediate relief. Okay, so let's keep going. The third thing I want you to try, or the third thing that was extremely helpful for me, was diaphragm breathing. Okay, and so what this is, I want you to lay down on your back, just like she is doing here. And what I want you to do is to press your back, your spine fully into the ground. So you can see she kind of has a bit of arch. I want you to press your back fully into the ground and find yourself some kind of weight or medicine ball. If you have one of those, great. If not, no worries. Find some kind of weight or just use your hand. The main thing is you want to make sure that you have some kind of like biofeedback around this lower abdominal region. We want this transverse abdominis to be active, to be used while you're breathing, while you're walking, while you're moving. Okay, so, oops, may have to edit that out. But, all right, so, yeah, take yourself a medicine ball and put that on your stomach. And what I want you to do is lay down, breathe, inhale fully through your mouth. So go into your stomach. You want to be pressing against that ball as hard as you can. Press against that ball as hard as you can when you're breathing in. Get a full deep breath. And when you feel like you can't get any more air, pause. And then try to pull more air into your stomach. So, and when you feel like you've got so much air that you can't even breathe anymore, that's when I want you to slowly exhale everything. Slowly exhale until you have no air left. So you breathe it all out. And when you feel like you don't have any more air, I want you to keep going. Just like that. So fully empty that air and make sure you are recognizing and feeling that medicine ball push into your stomach, and then feeling that transverse abdominis push against that ball when you fully breathe. And what this is going to do, this is going to turn your transverse abdominis back on. And this is a huge stabilizer. This is going to help. This is going to do a few things for you. I mean, it's going to help get space in between those discs in your spine. This is going to help with long-term relief. This is going to help get those discs off of that sciatic nerve so that you can experience relief. Okay, so right here, if you get that transverse abdominis active and stabilized, and your core stabilized and your spine lengthens, you're going to experience relief along that sciatic nerve. So that is diaphragm breathing. You can do it at home today. It's not hard. It doesn't take long. And gave me tremendous results when I was experiencing this. So give that a try. Let me know what you think. And so just to recap what we talked about today, these are the 3 movements that you can try today from home that should give you almost immediate pain relief from your sciatica. So we want to myofascial release those lower abdomens, that psoas, that iliacus, those regions down around your pelvis. We want to release those. We want to release up around your upper abs, so right up under your rib cage on the left and the right side. And these two movements right here are going to fully release that front line for you. The front line that gets oftentimes way too tightened and restricted and dehydrated when we sit too much. Okay, so release those 2 things. And this medicine ball diaphragm breathing, this is going to actually train your transverse abdominis to be active when you're breathing, when you're walking, when you're moving. And what that's going to do is to stabilize your core. This is going to prevent that herniation from getting worse when you're moving around, when you're rotating, when you're bending over, when you're extending, things like this. So give these a shot. Let me know what you think. Let me know if these helpful, or if these are helpful. Let me know how they work for you. And by the way, if you want the shortcuts, if these say give you a little bit of relief, but you want to go all the way, if you want to actually reverse this pain for good, I do offer a bit of consulting, so one-on-one coaching for you. If you are ready to just knock this out for good, I will hold your hand and get you out of pain. So again, this was me 4 weeks apart. Once I found the correct information, that finally helped me. 8 out of 10 pain down to 2 out of 10 pain, and I can help you do the same. And by the way, nowadays I'm completely pain-free and back to playing sports, living an active life. And so if this is you and you're just sick of dealing with this and you're ready for a way out, go ahead and click the book a call button. I'll link it down in the description. You can click to book a call, get a consultation with me. I may ask you to answer a few questions just so I can understand who I'm speaking with before the call. And by the way, right now, if we decide to work together, I will go ahead and just give you all this equipment for free. Okay. I do charge a small fee for coaching, but you would not have to worry about purchasing any of this equipment yourself. But if you don't want coaching, if you don't want any of that, just go ahead and give this stuff a try. Like, it's going to help you out tremendously with your pain levels. So give that a try. If you want coaching, there's a link down in the description. Otherwise, have an amazing day, and I wish you the best of luck on your pain relief journey.